The reaction of articular cartilage with osteoarthritic changes is fairly uniform. The decisive factor is that, in contrast to the healthy joint, the molecular weight of the body's own hyaluronic acid is lowered in osteoarthritis. As a consequence, inflamed fluid volume may increase in the joint, which further lowers the viscosity of synovial fluid. Since the production of hyaluronic acid is decreased as well, due to the hyaluronic acid-producing cells in the inflamed joint drying off, this effect is further increased. The consequences are reduced shock absorption and worsened lubrication in the joint, which cause further cartilage damage. Due to crucial breakthroughs in research, there is now a dual-chamber syringe that contains joint-opening, high molecular weight hyaluronic acid in addition to anti-inflammatory low molecular weight hyaluronic acid. The first chamber of the syringe contains low molecular weight hyaluronic acid. This forms a thin film over the inner lining of the joint capsule, the synovial membrane, and interrupts the inflammation cascade. At the same time, the enzymes breaking down hyaluronic acid are inhibited, and the body's own production of hyaluronic acid is stimulated. The goal is to restore the original environment of the synovial fluid in the synovial tissue of the articular cartilage. The second chamber contains the high molecular weight hyaluronic acid. Since the surface of the articular cartilage is not smooth, but has a very delicately wavy or better undulating surface structure, this kind of hyaluronic acid globules settles into these tiny cavities. The higher the pressure, the deeper they are pressed into the small dimples of the articular cartilage and at the same time are prevented from slipping out sideways. A gel shock absorber is born that widens and lines the intra-articular space. This leads to better lubrication of the joint as well as to better buffering of shocks during exercise. This dual therapeutic approach with low molecular weight and high molecular weight hyaluronic acid inhibits cartilage breakdown and the progression of osteoarthritis. Per joint, 2 injections are recommended on the first day, followed by 2 more per joint 7 days later.